Is it appropriate for your doctor to talk about their own health issues with you, the patient? Should a physician ever be judgmental toward their patients? What types of part-time activities are truly appropriate for a doctor as a side gig? Should physicians be held to a higher moral standard and serve as pillars of the community, even outside of medicine? In my public speaking engagements and also while mentoring pre med and medical students, these questions come up often, and there is not always a clear consensus because becoming a doctor is one achievement, it's one thing, but becoming a good doctor is another. So today's video is about what makes a good doctor and what makes a bad doctor, and it is part of our series, The Art of Medicine. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. So let's start with the rules I compiled, and of course, I'll admit there is some personal bias in them. So number one rule of being a good doctor is empathy. But what does empathy actually mean in real life? I believe that empathy is the opposite of judgment. It means seeing the human being in front of you, not just the diagnosis, the chart, or the symptoms. Imagine delivering devastating news to someone with, let's say, stage 4 melanoma, or imagine speaking to a patient who has suffered a terrible accident and may be paralyzed for the rest of their lives, or imagine having to tell a family that their loved one has died unexpectedly. And as a surgeon, I've been in all of these situations. Those moments teach you something very powerful, that people respond to pain and tragedy in a very different way. Some show incredible grace. Some break down completely. Some become angry and some become silent. And the truth is this: none of us truly know how we would respond until life puts us in that position. And that's why doctors must be prepared not only for medicine, but for humanity. And whether it's an extraordinary tragedy or a routine office visit, complete and genuine empathy matters. In fact, I will go further and say this: if a doctor is unable to feel empathy for a patient, then they should not be treating or working in any capacity with patients. And in fact, they should be looking for another job. Number two, morality. Morality is still a very important component of medicine. A doctor should not be immoral or have loose morals. Why does that matter? Well, recently I had a conversation with someone who described themselves as very tolerant. They said they believed that being an exotic dancer or a certain type of worker, and sorry, this is YouTube, so I will not be explicit, but to continue, being a certain type of worker would be perfectly acceptable for a doctor as a side or rather night job. And it was an interesting point of view. And yes, society has become more tolerant of many professions. But let's think deeper about what that actually means. The issue with being an exotic dancer and a certain type of worker is that you are selling your body. And some people may respond by saying, well, everybody is selling something. That is true to a point. But most people are selling skills or expertise that took time, discipline, and effort to build honestly. A doctor is treating disease, a plumber is fixing your sink, an electrician is wiring your home, a cook is preparing your food, and so on. So those are skills. But when someone resorts to selling their body, well, something deeper has been lost, and it is a loss of personal integrity. And a doctor cannot be in a position where they perform immoral activities after work and then return to medicine asking for trust. Because once someone becomes comfortable selling themselves, what comes next? Selling patient information, selling prescriptions, crossing ethical lines becomes easier. So medicine does depend on trust, and there is no room for that kind of divided character. Now, life is complicated, and there is also such a thing as forgiveness. So if someone did something like that when they were young, desperate, let's say, trying to care for a dying family member or survive severe hardship, of course, there can be compassion and understanding. But honestly, outside of these extraordinary circumstances, immoral activities should not be part of doctors' makeup. The next important rule for a good doctor is this: Do not talk about your own medical issues. In fact, it's unprofessional to focus on your own health problems during a patient visit. When a patient comes to see you, the doctor, the time between doctor and patient is limited, and that time belongs to the patient. It is their chance to be heard, to ask questions, and to receive help. So instead of focusing on the patient, imagine the doctor begins talking about their own symptoms, their own tests, their own struggles, and I've witnessed that. I think that's very wrong. Now, there again can be exceptions. Let's say a patient has lupus and you, their doctor, also have lupus. And then the doctor may briefly say, well, I have the same disease, I have lupus, and I understand what you're going through. And that may help the patient feel seen and it may come off as empathetic. But then doctor needs to turn it right back to the patient and say, tell me how you've been doing. And that is the key. Yes, there are, again, rare moments when there is time when the patient asks more personal questions. And in certain situations, doctor can share some aspect of their health, but it is a slippery slope. My general advice to young doctors, never share personal medical information unless there is a very clear therapeutic reason. The next important rule is the ability to say, I don't know. Medicine is constantly evolving and it's impossible to know everything. In fact, one of the things I love most about medicine is that it's always changing and makes you grow, and there's always something new to learn. And that's why I consider myself a lifelong learner. And there are situations, sometimes patients bring up a new supplement, a new treatment trend, something new emerging in functional medicine, or some obscure disease I may have heard about once in medical school and never seen again. And in those moments, I will say, I don't know. I need to look that up. Let me research that. And there's nothing embarrassing about honesty. And in fact, it strengthens patient doctor trust. False certainty is dangerous. And honestly, humility, especially in this situation, is very powerful. The next important point is professionalism and respect. Personally, I do not think that it's appropriate for patients to call their doctor by their first name only. I just don't think that it's right. I know society is more casual and many people like these informal greetings, but think of what many doctors went through to earn that title. Some worked 120 hours per week in residency, and I was one of those surgical residents. And in the process of this overworking, some lost touch with their close friends, some got divorced, some women never had the chance to have children because they actually spent their prime childbearing years in residency and building a practice. So these were sacrifices. And after all of that, imagine someone just casually calling you only by your first name, like you are their waitress. Hey, Jen. There's nothing wrong with being a waitress. I myself worked as a waitress and a dishwasher when I was younger. But medicine is a profession built on discipline, sacrifice, and responsibility. Yes, doctors are servants, but in a different way. And especially for women physicians, using only their first name can actually be interpreted as subconscious attempt to devalue their expertise and authority. And I don't think it's about ego. It's about preserving dignity of the patient-doctor relationship and also respecting the years of training, all these years required to actually achieve that and earn that title. At the same time, doctors should not become arrogant. For example, if someone mispronounces your last name, and I mean honestly mispronounces your last name, and because they just can't say it, that's perfectly fine. Especially, for example, for someone like me with a less common last name in this culture. I truly don't mind. I have heard many versions of my name over the years. Doctor is Azizian, etc. So being stuck on correcting patients that you may see once a year, let's say if they come in and they mispronounce your difficult last name, is honestly very self-indulgent. The next rule for young doctors is this: never be casual in medicine. That's a very important rule. And what does that mean? Even if a doctor works part-time, by the way, that doesn't matter. It doesn't give them the right to treat patients casually. So just to kind of unpack that. So think about this. Even the best prescription in the world, if given to the wrong patient or prescribed incorrectly, can cause tremendous harm. For example, a blood thinner can save lives, but in the wrong situation, it can also cause dangerous internal bleeding. So medicine requires seriousness. It requires precision, full attention, because small mistakes can create major consequences for the patients. So medicine should never be taken lightly or treated casually. And again, whether you work full-time, part-time, in surgery, in clinic, or anywhere else, because casualness in attitude often becomes casualness in behavior. Casualness in behavior can become casualness in the practice of medicine. And that may look like not listening carefully, missing an important symptom, rushing through an exam, forgetting to review a medication list, dismissing patient concern too quickly. Small moments of carelessness can create very large consequences. And of course, patients deserve much better. They deserve seriousness. They deserve focus. They deserve respect every single time. So I hope you enjoyed this video. I'm very curious to hear your thoughts and your observations on your interactions with your doctors. And please don't forget to like, share, and subscribe to support this channel. Thank you so much. Until next time. Bye-bye.